everyone, and thank you so much for tuning in to Carly BTV. I'm Dr. Karlisha Booz. The month of May is Stroke Awareness Month, and today we are joined by Monica Cook. She's the Stroke Program Manager at Piedmont, Macon. Thank you so much, Monica, for coming on the show.
Thank you, Carly. Happy to be here.
Thank you. So, Stroke Awareness Month, why is it so important, and what are some things we need to know?
For the month of May being Stroke Awareness Month, I really want to make sure people understand the severity of stroke. Stroke is the number one cause of adult disability, Carly, and actually 80% of all strokes are preventable. And right now, stroke is the fifth leading cause of death. So getting the awareness out there is very important and how to prevent a stroke.
Okay. Now we do know, according to the American Heart Association, someone passed away every 3 minutes and 11 seconds. So just to prevent that, you mentioned prevention. What are some of the preventions? Well, first, before we touch base on that, what are some signs and symptoms? Then dive into the prevention, please.
Yeah, absolutely. So, some signs and symptoms of stroke, it's a great acronym to remember to help you recognize the signs and symptoms. We say B fast. So, the B is pertaining to the balance or dizziness, any issues with balance problems. The E is for eyes. So, you think sudden vision changes. The F is for face. So, you could have the facial droop or the sensation changes on usually one side of the face. The A stands for arms, but think about arms or legs, and typically it's going to happen on one side. The patient's going to have those sudden symptoms of arm and leg or arm or leg weakness. And then the S for speech. So any speech changes. It could be slurred speech, or it could just even be maybe they've lost their words. They can't get their words out. And the T is for a sudden terrible headache and also time. So if you have any of the signs and the symptoms that we just talked about, and typically they happen suddenly, it's time to call 911. We're never trying to drive ourselves, and we never want to try to drive someone. We want that expedited VIP service, if you will, getting to the hospital as fast as possible through 911 emergency services.
Okay. And what are the preventions?
Sure. So the number one way to prevent a stroke is manage your blood pressure. That is the number one risk factor for all strokes. So keeping a watch on your blood pressure, having a blood pressure cuff at home, but also reducing your risk by not smoking, getting control of your blood sugar, even non-diabetics, making sure that you do know your blood sugar. And then also moving and exercising to your capacity that's safe for you, and talking with your doctor and understanding what risk factors you particularly have and how to fix those.
Okay. Now, just to be clear, Monica, a stroke can happen to anyone, not just,
Correct.
older adults, right?
Correct. Yes,
Okay.
that
I
is
just want
correct.
to make that clear because I know there have been conversations where people, they tend to think, well, it's just diabetics or maybe older people, but anyone can get it.
Yes, absolutely, Carly. Stroke can happen to anyone at any age, at any time. And matter of fact, a stroke happens every 40 seconds just in the United States. And Georgia, especially middle Georgia, is in the stroke belt, and we are the buckle of the belt. So we have the most strokes in this region. So knowledge is power, recognition is key, and rapid response.
Okay. Well, good thing Piedmont Macon make sure that their residents and people in their surrounding areas are educated. You guys actually have a stroke and stroll coming up May 15th, right?
Yes, absolutely. The stroke stroll is so exciting. It's going to happen May the 15th. We're going to kick off the stroll, which is a short celebratory walk inside in a designated area in our hospital. And it's going to be, we're going to kick off the stroll at 12:30. And then after the stroll, we will do our monthly support group meeting around 1 o'clock. We're encouraging all survivors to come out and we can celebrate them and their survival journey of stroke, but also they're welcome to bring their support team with them. So family and friends of the survivors are also welcome to come. And that's May the 15th. The stroll will kick off at 12:30 at Macon Medical.
Nice, nice. And one quick question. Are there any registration required or they just show up?
Yeah, so great question. They can just show up.
Okay.
Um, If they'd like to call the hospital ahead of time to let us know they're coming, that is okay, but it's not required. They can just show up on May the 15th between 12 and 12:30 to be ready for their celebratory walk at 12:30.
Nice. Well, thank you so much, Monica, and I hope this information is of value to our viewers. Thank you so much for coming on the show.
Thanks, Carly, for spreading the awareness.
It's What's Happening Weekend on KBTV, and this your boy Country Wayne.
Hey everybody, this is Tamala Man, and I'm rolling with Carly B TV.
Hey everybody, my girl Tamar Braxton, all the way live on Cardi B TV.
Yours truly, Atlanta's own MC Life, and I want to let you know I'm all the way live with Carly B TV. That way, the long way. I'm always Carly B TV. Peace up and A-Town down.
Yo, this Henry Wells, the most feared man in comedy. Street T, all the way live on Carly B TV. I'm here, baby. Check them out.
Yo, what's up? I'm Tony Terry, all the way live on Carly B TV. You heard me?
Poker Bear, all the way live with Carly B TV. You understand me? You gonna learn today, babe.